So let's look what is happening when this conductivity or this conduction is taking place. One of the first questions that you need to ask yourself is, do you have a P wave? And if there's a P wave, how is this P wave? Is it smooth and curved? A normal P wave should be smooth and curved. And if it's smooth and curved, then third thing that you need to ask yourself about the P wave is, it should be within 3 small boxes. Is it within the 3 small boxes? And if that's the answer is yes. The next thing that you need to ask yourself is, if you have a P wave, does it appear before QRS complex? All P waves must appear before the QRS complex. If then all these questions are correct or a yes, then that's a normal P wave. The next thing that you need to ask or you need to analyze is the PR interval. The PR interval begins at the beginning of P and it ends at where R starts. A normal PR interval will be within 3 to 5 small boxes. That is to say, if it is more than 5 small boxes, there is a problem. The PR interval represents the time the impulse travels from the SA node to the time it reaches at the AV node. Next thing that you need to analyze is the QRS complex. A normal QRS complex should be within 3 small boxes. When it is less than 3 boxes, that's a narrow QRS complex. When it is more than 3 boxes, then that's a wide QRS complex. The QRS complex represents ventricular depolarization. Now, having discussed about that, now let's look at the 5 key questions that you need to ask yourself when analyzing this rhythm. The first question that you need to ask yourself is the rhythm regular or irregular? If you have the answer of that, ask yourself the second question. What is the heart rate? To determine the heart rate, we have 2 methods. The first method is the 1500 method, and the second one is the 300 method. In the 1500 method, it normally takes the impulse 1 second to travel within 25 small boxes. That is to say, in 1 full minute, that is 25, we multiply by 60, this impulse will have traveled for 1500 small boxes. So for us to get the heart rate of the patient, divide 1500 with the number of small boxes. That's what will give you the heart rate of that patient. The second formula is using the big boxes. In 1 big box, we have 5 small boxes. If it's 25 small boxes, that means in 1 second, it should have traveled within 5 big boxes. So if in 1 second, it takes 5 big boxes, what about in 1 minute? We multiply that with 60 seconds. That would be 300. And that is why when we want to use, if you're using the big boxes to calculate the heart rate, count how many big boxes are there, then take 300 divided by the number of the big boxes. That will give you the heart rate. Then the third question is, do you have a P wave? Is the P wave present? And if it is present, then we say, is it smooth and curved? And if it is smooth and curved, is it within the 3 small boxes? And if the answer is yes, the next thing you need to ask yourself is, does it appear before the QRS complex? If all that is yes, then that's a normal P wave. fourth question that you need to ask yourself is the PR interval. And in the PR interval, one of the questions you ask is it within 3 to 5 small boxes? If the answer is yes, then also analyze the subsequent PR. Are they the same? In the first wave, is the PR the same as in the second wave, and the third wave, and the fourth wave, and so on? That is, analyze the subsequent PR, and if there's a problem, you pick that. There's a secret on that we'll be discussing. Very important, especially when analyzing the bradycardia. It gives you a clue of what type of bradycardia you're dealing with. The fifth thing that you need to ask yourself is, or what you need to do is, analyze the QRS complex. The first question should be, does the QRS complex appear after the P wave? And if yes, is the QRS complex within 3 small boxes? If yes, that's okay. But if it's less than QRS 3 small boxes, that is a narrow QRS complex. And if it's more than 3 small boxes, then that's a wide QRS complex. Having said that, let's use an example to analyze this reading.